Welcome back to the Wellness Pharmacist with Dr. Kat. I'm Dr. Kat, your host today. And this is our first ever 5-minute focus episode, which will be a quick evidence-based breakdown of the latest clinical research to help you make informed decisions about your health. Today, we are reviewing a February 2025 study in Clinical Rheumatology that introduces a nomogram, which is a predictive tool for assessing pregnancy risks in people with systemic lupus erythematosus, otherwise known as SLE or lupus. Whether you're a patient, a person living with this disease, a caregiver, or healthcare provider, let's make sense of what this particular research means for you. Now, this study was conducted at a single medical center between 2010 to 2023. And it was aimed to create a model to predict the likelihood of adverse pregnancy outcomes, otherwise known as APOs, in females living with systemic lupus erythematosus. So again, this is a single medical center, and it's difficult to extrapolate to all medical centers. But again, this is promising. This is a promising study. So I wanted to bring this to your attention. Lupus is an autoimmune disease that can lead to complications during pregnancy, such as preterm birth, preeclampsia, and fetal loss, as well as even the loss of the mother. Researchers in this particular study developed a nomogram, again, a visual predictive tool that estimates a person's risk of pregnancy complications based on various clinical factors. And the goal was to help doctors and, of course, the females that were pregnant make informed decisions earlier on in the course, because the earlier on we get to something, the better the outcome. So what did the study find? Here are the key takeaways. Number one, there were certain risk factors that significantly increased the chances of adverse pregnancy outcomes. And these include higher SLE disease activity, so flares during pregnancy, that's one. Two, the presence of antiphospholipid antibodies, APL. These antibodies in people predispose them to increased chances of clot formation. So clots during a normal person is not good. Clots during pregnancy is exceptionally not good. And then the third thing is the history of hypertension, so high blood pressure, or kidney involvement, and that's lupus nephritis. Those are the three factors that significantly increased the chances of adverse pregnancy outcomes. Now, the nomogram tool proved highly accurate in predicting complications in this particular study. More research needs to be done, but this was very promising. This helped the physicians assess a woman's risk in real time. Why does this matter? Well, earlier identification, as I said, of high-risk patients allows for closer monitoring and proactive interventions. Proactive, obviously, meaning before a complication happens, because we want to catch things before they happen, because then we have much better outcomes. It also supports shared decision-making between the females that were pregnant and living with lupus and healthcare teams. It's always important to include the patients with the healthcare team. Essentially, the study highlights the power of personalized medicine in lupus pregnancies. Personalized medicine meaning you look at each individual person and as unique. So you treat them individually and not just based off of the masses. What can people living with lupus and healthcare providers take away? For healthcare providers, we really need to repeat this study and in the masses to see just how great this nomogram is. We need to consider integrating risk assessment tools like this nomogram into prenatal care. So before people get pregnant, for those that aren't in healthcare, for females living with lupus. We want to monitor key risk factors like disease activity and antiphospholipid antibodies more closely, because we already do monitor them. However, more close observation is warranted And for people living with lupus, we want to encourage you to work closely with your rheumatologist and OB-GYN to monitor disease activity. Ask your doctor about early screenings and are there risk assessment tools that they can use in your particular situation. And if you have a high risk profile, first off, don't panic. Early intervention and monitoring can significantly improve outcomes. So it's very important to have an open conversation with your rheumatologist and obstetrician. For one, to make sure that you're healthy enough to carry a pregnancy, and then to know the risk factors and to know potential complications that can occur so that you have a plan to keep yourself and your baby safe. Before we wrap up, let's take a listener question. So Jennifer from Texas asks, I have lupus and want to get pregnant in the future. What should I ask my doctor first? Well, thank you, Jennifer, so much for your question. It's a great one. Here are 3 key things to discuss with your physician. Number 1, is my lupus well controlled? Again, pregnancy outcomes are better when lupus is in remission for at least 6 months. At least 6 months. So if you're in a flare or you constantly have flares throughout the year, this needs to get under better control. Okay. Now, 2, are any of my medications unsafe for pregnancy? So some lupus treatments like methotrexate, an immunosuppressant, they're not safe for pregnancy. They're what we call teratogenic to the unborn baby. So adjustments might be needed. And this is why it's important to talk to your OB-GYN and rheumatologist before you get pregnant so that you can plan to get your disease under control. And then you can plan any adjustments that might need to be made to your treatment regimen. And then, of course, we want to make sure that that regimen is safe for you and that you stay in remission 6 months prior to getting pregnant. And number 3, do I have any additional risk factors? Your doctor can screen for antiphospholipid syndrome, and they normally do during diagnosis. So they would probably already know this. However, kidney involvement, so lupus nephritis, that can develop over time, and hypertension, so high blood pressure. These 2 things need to be closely monitored throughout your lifespan and especially during pregnancy. So, because these can all affect pregnancy and the outcome. If you're considering pregnancy, please talk to your OB-GYN and rheumatologist. Early planning is critical. Well, that's it for today's 5-minute focus. I want to thank you for listening. This study brings exciting progress in personalized pregnancy care for lupus patients. And if you or someone you love has lupus and is planning on a pregnancy, share this episode with them. For more information into clinical research, subscribe to the Wellness Pharmacist with Dr. Kat. And if you have any questions, please drop them in the comments or message me on social media. I'm on Blue Sky and I'm on YouTube under the Wellness Pharmacist. And my email is innovationsmedicationmgmt@gmail.com. And until next time, please take care. Thank you for listening.